What's up guys, B-Rob here, and this week's Foods That Fight series is on diabetes. I'll be right back. So this week's Food That Fight episode is on diabetes. And before I go any further, if you're new to the Foods That Fight series, please look right here. See this? That video that just popped up there, that will take you back to the intro video, which lays out what the Foods That Fight series is all about. And after if you want to leave and go watch that video, please come back and join. But if you want to stick with me, you probably can figure out how this is laid out. But anyways, this week we're going to talk about diabetes. And the thing about diabetes is it's one of those diseases that I have seen around me in my life, growing up from family and friends and things like that. And it's one of those things that seems to be confusing to a lot of different people, and it's confusing to people with it, and it's confusing to people without it. And in order to really understand, you have to almost have a really good understanding of macronutrients. That's your fats, proteins, carbs, what your body does with those, what those do to your body, but also insulin, what insulin is made for and what that does, as well as how the foods that we eat may contain those micronutrients and how those foods work to help us or against us, those with diabetes. Okay, so in this video, hopefully I can make it a little more clear, but for more information on this, please go to the blog, or if you're already here watching this from the blog, in the blog down below, you will be able to get a little more info. I'm just going to share kind of a quick overview here in this video, but the blog is located at LEANWellonline.com, so please go there and watch the blog if you're not watching this video from there. Okay, so let's go ahead and get on with diabetes. So what exactly is diabetes? So diabetes is a disease in which the body has a problem, or it's got an inability to produce and respond to the hormone insulin. So what happens is when the body doesn't make it or doesn't respond well to insulin, then that creates the misuse of carbohydrates, which then creates a situation where you have elevated blood sugars or blood glucose, blood sugars. And that elevated blood sugars can cause a series of other issues, right? So a person with diabetes and with too high blood sugars, what that means is that there was no insulin, or the insulin didn't respond well enough to clear the blood of the sugars and push it to the cells, where the cells store that, whether it's the muscle, fat cells, or liver. It stores that insulin to be used, or I'm sorry, it stores that carb, that energy, that blood sugar, that sugar to be used when you're active, right? So what happens is insulin is not present, or your body doesn't work well enough to cause those cells to open up to where they can absorb the sugar, and it clears out the blood, and that way you have it in those cells for energy, right? So there are two types of diabetes. Diabetes type 1 is a person who doesn't make any insulin at all right? So they're not able to make insulin. Now, diabetes type 2, a person with that is, and this is the most common type from all the research that I've done, this is a person whose body isn't making it well enough, or it can't use it well enough, all right? And so both will lead to too much sugar in the blood, which leads to other complications. Now, some of those complications consist of eye, kidney, and nerve damage. Some other complications can lead to stroke or heart disease, and even loss of limbs. And I've seen that happen from family members, friends, and things like that. Pretty much all of those things. So I want to educate you on a little bit on diabetes and insulin, but also share with you the foods that you can eat that research has shown can possibly help you control your diabetes, prevent you from getting diabetes, and even reverse type 2 diabetes. Okay. So first one is salmon. Now I know that you may see salmon as one of those food fixes for a lot of different diseases. Now salmon has omega-3 fats, and these are the good fats. And in our diet, in our Western civilization, our culture here, our Western diet, we don't really get enough omega-3s. We get a lot of omega-6s from the meats that we eat and the different things that we eat, but omega-3, we don't get a healthy enough ratio typically. So these fatty fish come in handy for us to implement into our diet in order for us to get what we need. Now, when I was looking through research on the foods that help, there was some conflicting research with fats, with regards to fats and diabetes. So there's been some altered diets where some doctors and some scientists had done some studies, and they were recommending a diet that's low in fats for diabetes, for the simple fact that there may be some fats. It may be the situation where fats will kind of interfere with the uptake of insulin. So there is some, I do want to make you aware, there is some research that may say, and there's some doctors that may say they may have you on a low-fat diet. Now, if they do that, I'm not a doctor. They are the doctor. They're the professional. I do not want to go against whatever their recommendation is for you. But there is also research that says that fatty fish will also help, right? So for this, I chose salmon because of the omega-3 fatty acids, but also salmon has protein, and protein will keep you full faster. And part of dealing with diabetes is the irregulation of the carbohydrates, which could lead to possibly more hunger or more, just wanting more carbs, right? So proteins will help keep you full, and that way you won't be craving the more carbs that could possibly cause your blood sugar levels to be off, right? So something else that salmon has is it's high in vitamin D and high in B12. But the benefits of salmon and other fatty fish like this is that it is with the omega-3s, and these omega-3s that are fats that are in salmon have DHA and EPA. So one of the reasons why I did want to choose salmon over any other kind of lean protein type is because of the omega-3s and how the DHA and EPA may actually help against the side effects of diabetes, the things such as stroke or heart disease and some of the other issues that are caused, okay? So just know that salmon was chosen. It is research backed, although there is conflicting research saying that fats may not be good. There is a lot of research says that they are, and I chose salmon because of the other benefits that could possibly negate some of the side effects of having diabetes and the high blood sugars. All right, so the next one is spinach. So spinach is a good source of antioxidants. It's low in calories and digestible carbs, and it's a good source of vitamin C. So the thing about spinach and its antioxidants is it may protect your eyes. The antioxidants in spinach, research shows, could possibly protect your eyes, which we know that diabetes, high sugar levels can affect your eyes, can cause some issues there. But also, it has low digestible carbs, and these carbs have been known to not spike your blood sugars, which means that you don't have to worry about having, just these blood sugar spikes and too much sugar in the blood, right? Research also shows that the vitamin C, like what's found in spinach, may reduce inflammatory markers and fasting blood sugar levels in people with type 2 diabetes, all right? So then the next one and the last food that I chose here is walnuts. So walnuts are a good source of fiber, folate, and omega-3s. Now, fiber is one of the 3 types of carbs. You definitely want fiber in your diet, and a lot of times in our diet and in our culture, we don't really get the recommended dosage or the RDA of fiber. So for people with diabetes, fiber is one of those important things that you need to have, right? So studies suggest that walnuts and the consumption of various nuts in general, and I do want to let you know that in the list of nuts that are listed in the research, peanuts are not one of those. The nuts that are listed are more like almonds, walnuts, pecans, pistachios, and just the different nuts like that. But peanuts was not one of those that was listed, so I do want to make that clear. But also, they may have anti-inflammatory properties that that could lower blood sugar and HbA1c levels. Studies suggest that the polyunsaturated fats that are in walnuts may produce a significantly greater reduction in fasting insulin levels. All right, so those are the 3 foods that were chosen. And if you go to the blog at LEANWellonline.com, then you can see how I eat these foods. Now, I do want to add my disclaimer again. I don't have diabetes, so if I tell you how I eat these foods and it doesn't fit with, it's just my experience. If it doesn't fit with what your doctor has you on for a meal plan, then please do not eat like I do. But I'm just giving you some examples of how I eat them, and that may spark some creativity for you or something like that. All right, so I do want to ask you to go check out the blog at LEANWellonline.com if you're not already there. After you read the blog, please hit that little heart button right there. So when you hit that heart button, that lets us know that you read it, you like it, and it keeps us motivated to put out more blogs. Also, please like, share, and subscribe right here to my YouTube channel. This is B-Rob, and thank you guys for tuning in. I really appreciate you. This is B-Rob.